You also can't force somebody who's earning a certain amount of income to be on a medical scheme product when it's a disproportionate amount of their income. It just,
Absolutely.
when people are needing to buy school shoes and they're needing to buy groceries, how can you force people to be on a scheme product that really is limited in terms of how far down you can get that premium?
Hi and welcome. My name is Claire Mawisa, and this is Health of the Nation, a podcast series of conversations about a topic being hotly debated across the land: healthcare. Who has and doesn't have access to it, how expensive it is, and who should be paying for it. Our current conversation in the country about health insurance has highlighted the prohibitive cost is still a barrier to healthcare for so many South African workers. But silver lining, some of the country's biggest corporations are taking steps to secure coverage for their employees. And joining me now to discuss how they've listened to and taken action on employee asks is Gillian McMahon, Executive Director at the Bidvest Group Limited, and from Dis-Chem Health, Executive for Integrated Health, Jessica Bates. Ladies, welcome to you both. Now I'm going to start with you, Gillian. Bidvest recently adopted a medical insurance scheme across the group. Can you tell me how you arrived at that decision?
It's a long story. So it's been a journey. We didn't just arrive at it, woke up one day and decided we're rolling out a medical insurance product. And maybe to provide a bit of context, we have a total employee base in South Africa alone of about 90-odd thousand people, of which I would say approximately 70,000 people are mainly in the security business and the cleaning industry. And then we have a majority of warehouse workers and factory workers as well. I would say the majority of that employee base doesn't have medical insurance cover of any kind. Recently, I would say about 2 to 3 years ago, the security businesses or the security industry managed through their own bargaining council to negotiate a medical insurance product for our security businesses, our security employees, but that was for the security industry as a whole. We were still sitting within the majority of our people in our cleaning industry, factory workers, and warehouse workers that were without. We always knew we needed to provide some form of medical assistance to our staff. It was the how we were going to do it, given the sheer volume of people that we employ in the group. So, of course, there is a cost, as you would call it, that needed to be taken into account. So it was a matter of saying it wasn't a matter of the when or the if, it was a matter of just the timing and how we would do it. Then COVID came. As we all know, and we know what happened during COVID, normally our group operates on a decentralized basis where every business makes a decision for themselves, like they do, their operating model. You operate independently, you make decisions as far as your employees are concerned and your business as a whole. When it came to COVID, we decided we couldn't just leave it be. We had to take control from a group perspective because we knew that we had to take care of our staff. Our staff are our number one. And we knew that we had to make sure that everybody was treated consistently. Knowing what happened during COVID, people were at home. Our people were still they're on front lines. They were still going to clients' premises. Premises still had to be secured. People still needed cleaning to be done, so on and so forth. And we realized that we needed to give them some form of support. We couldn't at that point roll out a medical aid insurance, but we knew that they needed access to facilities such as counseling. It was a financial advisory services because there you were not sure whether people were going to get salaries or whether they were, just forced to take leave. We had made a call on all of that, and then we decided we were going to roll out an employee wellness program. And the employee wellness program was really an employee assistance product. We decided as a starting point, we would give people access to counseling if they needed it, because people were suffering with mental illnesses during that time, depression, all sorts of things related to family, being at home in a closed-knit environment. And we thought, as a starting point, let's do that, which we did. So in 2020, we rolled out an employee wellness program, and we thought that was a starting point for them. The next step we did was we decided, okay, we still need to make sure that our employees are taken care of. We then rolled out the vaccine program, and to make sure that everybody who would want to take the vaccine had access to it and the company would pay for it. So we rolled that out across the group as well, which was fantastic because, again, medical aid generally would cover that. The majority of our people didn't have access to medical aid. So we didn't want them to have that financial burden and didn't want that to be the reason that they couldn't get the vaccine should they wish to take it. Following that about a year ago, still with medical insurance in the back of our minds, we had a lot of chats. We spoke to, as an exco, we spoke to our senior leadership teams and we planted the seed and said, come hell or high water, this is the year we're going to do it. And we then started, I would say, interviewing different service providers at group level. And we said, let's look at what we think would be relevant for our people. What the offerings are out in the market, it was still very new to us. So we interviewed a couple of service providers to see what it was. At that point in time, as we sat there in total ignorance, thinking people need access to hospital care. People just need to be able to have access to private health care, because we thought that is really the issue. And then we took another step back and said, hang on, before we make any decisions, we don't know. We don't know what a day in the life of someone actually is. And then we went out and we did a little bit of a survey amongst the majority of our people. And it was interesting what came back. We sat there thinking it would be a hospital plan. What came back was quite the opposite. People didn't want a hospital plan. They wanted day-to-day care. So pharmacy visits, GP visits, to the dentist, the optometrist. That is where they were spending their time. We found out that people were going to the doctor if they just needed to see a GP. You would go in the morning and you would sit there for the entire day because you can't make an appointment. I mean, it's not private healthcare. You have to sit for hours and wait until you actually see the doctor. So that's an entire day away from work. That's also a day away from, being away from your children early hours of the morning, not sure what time you're coming back in the evening. There's transport costs that have to be incurred. Sometimes they don't get to see the doctor on that day and they actually have to go back a second day. So just the inconvenience of it drove the need to say all we need is just to be able to access private healthcare in terms of facilities, whether it be the pharmacy or whether it be a GP. And that was very interesting for us. So that changed the entire mindset for us in terms of what we need to be looking at. So as we called in different service providers for different medical insurance products, we had that in the back of our minds. So where the biggest need actually laid. The other reason for also choosing the product that we went with, which turned out to be the medical insurance product, was because it really addresses preventative health care. And we also realized that the more access people have to doctors or even to a pharmacy where you can do just a general health check, you will find out if you have high blood pressure as an example, or if you have chronic illness as an example, you can take preventative measures for it. As opposed to, in the most cases, people find out when it is too late. And by that stage, you actually have to then go into hospital.
So early detection actually is better than the later stage of anything developing.
Absolutely. I mean, it was a learning curve for us as well. And I think it's a lesson for everybody, especially for us as employers in corporate, is don't make assumptions, just do your homework, ask the question and see what the people that matter, see what they actually say. What do you need? As opposed to trying to push something down the line that people don't really need. And that was also the difference between taking a medical aid, which is very expensive, costly and really unaffordable for most South Africans, as we sit here today, versus a medical insurance product. Medical aid, There are certain benefits, predetermined benefits that are built into the product that people generally hardly even use. So we were trying to figure out what is it that our people actually needed. And that's how we ended up with the product that we have today.
Jess, are you surprised at that feedback? As Gillian is speaking, are you surprised at the feedback that the staff gave? And how does that feed insights for you in the future when it comes to understanding how people need to access medical insurance?
Sure. I mean, it now that I have the stats to look at in terms of how our staff are utilizing the product, it doesn't surprise me, right? But I think that does show you how sometimes our kind of preconceived ideas about what people need versus when we actually start to hear what they need and see some of the evidence. So similar to Bidvest, we've got around 19,000 of our staff and their dependents that are on a medical insurance product. And also some history on our side. So it was around 2016 that we identified a very similar issue, right? I mean, we have a very small percentage of our staff that were on medical schemes. And isn't it ironic that we're a health provider? We have dispensaries and clinics that our own staff weren't able to utilize if they got sick. Or if they needed preventative care or need their chronic medication. So I think so that's when we started exploring the options, and that's where we met our partner Kaelo. And so then we obviously also similarly did a medical insurance rollout to all of our staff, so that we've basically got a mandatory cover. So you either, depending on what employment band you're on, you either need to be on a medical insurance product, which we fully subsidize, or you need to be on a medical scheme. So we feel like, with that, there's a sense of comfort in that we're giving staff options in terms of what they can afford, because I think some of the feedback we also got when we did similar surveys and things that we knew about was that you also can't force somebody who's earning a certain amount of income to be on a medical scheme product when it's a disproportionate amount of their income.
Absolutely.
When people are needing to buy school shoes and they're needing to buy groceries, how can you force people to be on a scheme product that really is limited in terms of how far down you can get that premium? And then if you take that a step further, how can you then kind of force people to be on a scheme product and they then can't afford to put their family members on it?
Yeah.
Because it's too expensive for dependents to be on it. So we also, the reason why considering an affordable funding option was that we would subsidize it for our staff and then give them the option to put their family members on. And I think we've got about 5,000 dependents where people are voluntarily putting their spouses and their partners, their children on so that they can also access cover. I mean, it makes no sense that if you're sick, you kind of, as the employee, can go to the doctor or go to the nurse. But then if your child gets sick, you're back in the same position in terms of having to take the day off and go to the public clinics and hospitals. So that, and when we look at some of the utilization stats, I mean, in the last 6 months, out of those 19,000 people that are covered, we've had almost 10,000 people access a GP during that time.
Wow.
And that is 10,000 instances where somebody probably would have had to take the day off work to go and seek care. We've had 1,000 of our staff members go to the dentist over that time, over the 6-month period. So, as much as it's great as an employer that we get the benefit that we're not having to worry about when people are calling in sick, how do we fill that gap for the day? How do we get temporary workers, the extra cost associated with that absenteeism? But we also, we've got comfort that our staff are really actually utilizing it and it's making a difference in their lives. So, we not only hear that staff are benefiting from it, but we see it in the stats in terms of the utilization.
Those stats are so interesting. So many insights can be drawn from those stats when you're talking about how employees need to access healthcare. The assumptions we sometimes make will really make you take pause. Any comments, Gillian, about that utilization?
Yes, and it's very interesting. It shouldn't have been surprising, but it was surprising given what we thought our people needed versus what they actually needed. If you look at the total utilization to date, more than 60%, actually just less than 70% of utilization is actually at the pharmacy. So people are going to the pharmacy for day-to-day checks. They're going for chronic medication. A lot of people also, we realized, have hypertension. So they are doing pharmacy visits and they're doing consultations at the pharmacy. It is so convenient because where our people are based, they're generally based at customer premises, which you would find it more in urban areas. So you will find that accessibility to a Dis-Chem, as an example, is far easier than having to wait to go to a GP, which they would have to take time off and they would go to wherever the closest GP would be. So just from a convenience and accessibility point of view, the utilization, I think, is also impacted by that and influenced by that. The next highest utilized service is GPs, and then followed by dentists. So that was very interesting to us. So while the day-to-day cover is really important and it's proving to be very beneficial to our people, the hospital cover is also quite important, and it's proven to be so important to a few employees that I'm aware of in the group that has utilized the hospital benefit for emergency services. And you'll hear a little bit more about that from the employees directly, which is really wonderful. And it's really heartwarming to know that having introduced this product has made such an impact on people's lives.
Well, on that note, let us hear directly from the Bidvest group staff.
Hi, everyone. I am an employee of Silver Ray Stationery Company, a division of Bidvest. So last year, on the 24th of December, last minute Christmas shopping, I actually fell ill. I couldn't feel my left-hand side. I couldn't talk. So when my husband realized what was happening, he drove me to the nearest private hospital. He presented them with the Kayola health card. The staff did not hesitate to assist us. I was admitted to the ER where all the blood tests and CAT scan and all the other tests were done. When the results came back, it was actually confirmed that I suffered from a mild stroke. I'm away from my family. I'm admitted into the hospital. And now I need to think about, will I have to pay extra for me being admitted and for all the medical expenditure that is happening? Kayola actually pulled through. They paid for everything. And truly, truly grateful to Silver Ray Stationery Company, not only for providing me, but for providing my family with Kayola Health medical insurance, and for also prioritizing my health as well as my well-being.
Hi everyone, I'm employed by Bida Cargo based in Johannesburg. On the 8th of November 2023, I received a call from my 13-year-old son who had been severely injured during a school match rugby. In that moment of panic and confusion, my only priority was to get him to the nearest health facility for urgent care. I arrived at the hospital shortly after the ambulance, and then I managed to see my son before he was taken to the ER. The X-ray confirmed dislocated hip, and the doctor advised that my son needed a urgent surgery. And then I returned to the reception to contact Kaelo for approval. I was relieved to hear that the pre-authorization was granted to cover the medical cost, including the hospital admission. My son underwent the successful surgery the following day, which was on the 9th of November 2023. In total, Kaelo covered over 75,000 for my son, which included the ER consultation, surgery, X-ray cost, crushes, and physiotherapy. The fact that Kaelo was able to cover the cost only after 3 months of us joining was remarkable. I want to take this opportunity and express my heartfelt thanks to Bida Cargo, Bidvest, and the entire executive team and my colleagues for the unwavering support during the challenging time.
Jessica, I think that the takeaway here is that corporate medical insurance coverage is possible for staff on every level.
I mean, it's true, right? So we might have to be a little bit more creative in terms of how we think about it. in South Africa, because of the regulatory framework, we don't have the ability at this point in time to offer a low-cost benefit option, as it's sort of described in the media, right? A medical scheme product that can get to a level of affordability that that is appropriate for all staff. So that's why a medical insurance product does allow us to offer a affordable funding solution for staff. So we absolutely recognize that it doesn't have the full, what we call PMBs, the prescribed minimum benefits that a medical scheme would have. We absolutely understand that. But at the same time, offering staff nothing is actually a worse outcome, right? While we wait for something to kind of a product to be developed, or the regulatory landscape to catch up. So that's why we felt that we need to use the products that are available to us, and that is in the medical insurance space. So to enable our staff to get some form of cover, and I think that's the message that we're also taking to corporates, to say, if we have to wait for these solutions and for the regulatory landscape to catch up, we're going to be waiting a long time. It takes a long time for these things to change. So rather just go and have a look at what's out there, and you may be very pleasantly surprised in terms of the degree of cover you can provide to staff. And I think it's also quite crazy when you think about how most corporates are subsidizing medical schemes for their staff, but there isn't any subsidy for any other kind of healthcare funding product. So we've taken on the responsibility of subsidizing that for our staff, and because we think it's fair. If we're going to be subsidizing a medical scheme product, we must be subsidizing a medical insurance product for staff where it's appropriate. And I think often corporates get a little bit nervous because it takes a lot of time to go and have these engagements with staff, to wrap your head around what's the appropriate products for your staff, then to go and find the appropriate provider that you want to use or insurer that you want to use. But so it's a little bit daunting to go and undertake that task. And we find, with our partners, that often that process can take 18 months, of engagement and determining what's the right thing and selecting the right provider and then implementing. But, corporates kind of just need to get on the journey, start engaging with staff about what their staff needs, start looking at the alternatives that are out there. And then, we all know that within a blink of an eye, that time has passed, and then hopefully you'll have a solution for staff. And the more we can get our employed population to use the excess capacity in the private sector, the more we know that the public sector can focus on the population that isn't employed. They don't have the ability to go and pay out of pocket because they just don't have any income. And I think that would allow us, the goal of all of this is to try and effectively utilize the medical resources and skills and infrastructure that we have in South Africa in a better way,
Right.
and try and even out this unequal distribution of utilization across the private and public sector.
Right.
Gillian, any closing thoughts?
What Jessica's just spoken about is so important because it is possible. It really is possible to do it. As an employer, we also made the decision that we were going to subsidize the medical insurance product. In some cases, it's fully subsidized across the group in 100% of the covers paid by the employer. And in some cases, it's about 60%. It ranges between 60 to 100% because we want to be able to assist. We do see it as our responsibility as well. And the product is a great product. It is well positioned, well priced. That also to the extent that these employees have now, and Jessica spoke about it earlier because it's happening in Dis-Chem as well, that they have taken it out for their family members in their personal capacity. So the benefit of that is also, because of the volume that we have, we were able to negotiate better rates even for family members. So that has been very successful. And as Jessica said, because people are finding that I've got medical cover because I'm an employee of Bidvest, but my family members don't. But because they've seen the benefits of it and also just the affordability of such a scheme, they were able to then say, no, this is worth it. We're able to do it. And again, as Jessica said, I have to go back to what she says. You have to start somewhere. It doesn't matter what it looks like. as long as you know that it is targeting a need for your employee base. But it's a journey. I mean, we're targeting probably about 47,000 people to roll into this. We currently have, I think it's just under 10,000 people that's now being covered, but we're targeting 47,000 people. We also have to negotiate with bargaining councils. We have to work through trade unions. So there's a lot of consultation and engagement with various stakeholders involved. But the journey's begun. We've already got our people rolled on, and we're gonna continue the journey for sure.
Well, on that note, we're hoping that this conversation plays a small role in sparking the discussion in your organization about this very topic. So thank you so much, Gillian McMahon, Executive Director at the Bidvest Group Limited, and from Dis-Chem Health, thank you so much, Jessica Bates, Executive for Integrated Health. Let's keep the conversation going. And remember, this was episode 2 of Health of the Nation. Make sure that you catch the entire series wherever you get your podcasts. Until then, yours in good health. Goodbye.